During this haze, there's an increased incidence of acute infections of both the sinuses as well as of the throat. So I see more cases of acute sinusitis, acute exacerbations of allergic rhinitis, as well as acute pharyngitis. And some cases even have severe ulcers developing in their throat. There are many types of particles in the haze. It's not just the particulate matters. Some of the other ingredients in the haze would include chemicals. Chemicals such as sulfur dioxide and nitrous dioxide. This would increase the acidity of the air that you breathe in. So once it changes the pH of your nasal lining and pH of your pharyngeal secretions, it tends to alter the internal environment of your throat, and it can result in sinus infections and throat infections. Any type of people will be affected by it. Normal people can fall ill. There's a higher incidence of viral infections and bacterial infections. But if you are young, or if you're elderly, or if you have predisposing factors like if you have underlying allergic rhinitis or asthma, then you would have more higher chances of getting infected. Prevention is always better than a cure. So first, put a mask. That's a form of barrier against the haze if you do need to go out for extended periods. You can also have air filters at home or air filters in the office, and that will reduce the amount of exposure. But once you have an exposure, you do have access to saline washes that you can use. You can have gargles for the throat, you can have nasal douches for the nose. That would then dilute the amount of irritants or allergens that is in contact with yourself. You should limit your outdoor exposure such that there is less exposure when the PSI is high. Or you can also reduce the outdoor activity levels. When PSI is high, not just do you go out less often, you don't increase your exercise level. Try not to be too active outdoors. Other things that people can take note of would be to maintain their hydration. They should drink more water so that the salivary secretions are less concentrated and there's a less chance of getting an infection. And they should also try to see a doctor if they catch an infection, because sometimes they might need antihistamines, they might need antibiotics, they might need nasal douches. In this situation, when the air is quite bad and if there is a lot of particulate matter and quite a lot of chemicals in the air, if you use a nasal douche, which is essentially hypertonic saline in a bottle, you use it to clean your sinuses, it tends to wash away all the irritants and allergens that's in the air. So it tends to diffuse the effects on the lining of the nose and the throat.